Hi and welcome to my channel. I am Dr. Kalyan, a consultant cardiologist. Imagine, Mr. Thomas, who is a 51-year-old gentleman, is exercising on the treadmill. He is a diabetic on treatment. He experiences left-sided chest discomfort which radiates to the left arm. He goes to meet his cardiologist, who orders basic laboratory tests: a blood troponin, an electrocardiogram or ECG, an echocardiography and an ultrasound of the heart, and a cardiac treadmill test. The cardiac treadmill test, the cardiologist says, is not normal. He then asks Mr. Thomas to get a coronary angiography. The coronary angiography, which is a X-ray visualization of the heart arteries, reveals blockages in all three arteries supplying the heart. The cardiologist further advises that since he is diabetic and has multiple blockages, he needs a coronary artery bypass surgery. The cardiologist says that in Mr. Thomas's case, this option is preferable over coronary angioplasty, also called percutaneous coronary intervention or PCR. What is coronary artery bypass surgery? Coronary arteries are blood vessels supplying the heart. When coronary arteries are blocked, the cardiac surgeon creates new paths or channels by bypassing the blocked segment of the coronary artery. This is usually done when the blocked segment cannot be opened up by angioplasty or there are many blocked segments. This is called coronary artery bypass surgery. The surgery involves taking a healthy blood vessel from the chest or leg area. The vessel is connected below the blocked heart artery. One can imagine constructing a flyover to get beyond a congested street and bypassing the congestion. The flyover is the graft. The new pathway improves blood flow to the heart muscle. It is also called coronary artery bypass grafting, CABG, cabbage or heart bypass surgery. Mr. Thomas now visits Dr. Matthew, who discusses the bypass surgery with him. Mr. Thomas is apprehensive. Dr. Matthew informs that coronary artery bypass surgery is an open heart surgery. All surgeries have some risks. CABG surgery is now performed very safely because of advancement of technology. There is a risk of bleeding, infection at surgical site, irregular heart rhythms or arrhythmias, kidney problems, memory loss, stroke, paralysis or even death in some cases. Dr. Matthew guides Mr. Thomas. Thomas gets admitted the day prior to surgery. Coronary artery bypass surgery is a major surgery done in a hospital. Mr. Thomas is administered general anesthesia by the cardiac anesthetist, which puts him in a pain-free, sleep-like state. Doctors then proceed to insert a breathing tube through the mouth, which is connected to a breathing machine called the ventilator. The ventilator takes care of Mr. Thomas's breathing during and after the procedure. The coronary artery bypass surgery usually takes 3 to 6 hours depending on the number of blocked arteries. Dr. Matthew makes a long cut down the center of the chest along the breastbone. After the chest is opened, the heart is temporarily stopped with medicine. The heart-lung machine is turned on. A heart-lung machine is used for Mr. Thomas's procedure. It takes care of blood flow and oxygen during the surgery. This is also called on-pump coronary artery bypass surgery. The surgeon removes a section of a healthy blood vessel. This piece of healthy blood vessel is called a graft. Grafts are usually taken from an artery called the left internal mammary artery in the chest, and also from blood vessels in the legs called the saphenous veins. Dr. Matthew attaches the ends of the graft below the blocked heart arteries. This creates a new pathway for blood to flow around a blockage. Mr. Thomas receives 3 grafts, 1 arterial and 2 venous. The surgery is successful. The heart-lung machine is stopped and the heartbeat restored. Dr. Matthew then uses wire to stitch the chest bone. The wire stays inside the body and does not have to be removed. If the heart-lung machine were not to be used, it is called off-pump coronary artery bypass surgery or beating heart coronary artery bypass surgery. Some surgeons now perform coronary artery bypass surgery through small chest incisions, in which case the surgery is called minimally invasive coronary artery bypass surgery. Mr. Thomas is taken out from the breathing tube after 6 hours when he is able to breathe on his own. He spends a day in the coronary intensive care unit and 2 days in the inpatient wards. He is then discharged. Dr. Matthew asks Thomas to look out for any worsening chest pain, breathing difficulty, fever, dizziness, fast heart beating, discharge from the wound sites, or any bleeding from the wound sites. Mr. Thomas has to report to the hospital in 7 to 10 days for suture removal and inspection of the surgical site. He is also given medications. Dr. Matthew says that Thomas will get well in 1 to 2 months. Mr. Thomas can do his activities of daily living immediately post-discharge. He can drive and start exercising in about 4 to 6 weeks. He can resume sexual activities in 4 to 6 weeks. Advice for Mr. Thomas: take medications as prescribed and follow up with the cardiologist. Eat a low-fat heart-healthy diet, preferably in consultation with a dietitian. In Mr. Thomas's case, he also has to take a diabetic diet and avoid sugar. Exercise regularly for at least 30 minutes for 5 days a week. Stop smoking. Enlist in a cardiac rehabilitation program. Manage stress and sleep well. If you like this video, please hit the like and subscribe buttons for more such content. Please feel free to comment and get in touch in the comment section below.